In this section now we will talk about the middle ear and mastoid carcinomas. What's the etiology and pathology of middle ear and mastoid carcinoma? We will discuss about that in this section. And also what are the clinical features of middle ear and mastoid carcinoma, diagnosis and treatment of middle ear carcinoma. So first the carcinoma of the middle ear and mastoid. In the classification of the tumors of middle ear and mastoid, we said we classify it into primary and then secondary tumors. Primary tumors, we further subdivided them into the benign and malignant tumors. Benign tumor was the glomus tumor, which is the most common benign tumor, less invasive, localized. And then the malignant tumors, we said, was the carcinomas and sarcomas. So we already talked in detail about the benign tumor, which is the glomus tumor of the middle ear and mastoid. So carcinoma, now let's start talking about the carcinoma of the middle ear and mastoid. There are one case in 20,000 new patients examined. So 1 in 20,000 patients can have carcinoma of middle ear and mastoid. Commonest primary middle ear malignancy. So primary middle ear malignancy, the carcinoma are the most common malignancies are of primary of tumors of the middle ear or mastoid. Like glomus tumor was the most common benign tumors of the middle ear and mastoid. The causes of carcinomas, we have primary carcinoma of mastoid ear cells observed in radium dial painters. So usually the radium dial painters are the painters who paint the sides of the clocks, and they are the one who can develop the primary carcinoma of mastoid ear cells. Affects age group of 40 to 60 years. As the glomus tumor, we said it affects mostly the females. The age group was roughly the same. We said 40 to 50 years. This is also 40 to 60 years of age. So age for the benign and the malignant tumors, primary tumors of the middle ear and mastoid is almost the same, middle ear neoplasm. Slightly more common in females. The glomus tumor was common in females also. So the primary tumors of the middle ear and mastoid, they are more common in females as compared to the males. 75% cases have associated long-standing ear discharge. So ear discharge is present in about 75% of the cases with the carcinoma. Chronic irritation is present also in patients with the carcinoma. And there is radical mastoid cavities are present. So these are the etiologies of or the causes of the development of carcinomas of the mastoid and the middle ear. So more common in females. Radium dial painters can have it more. Associated discharges more common in patients who have ear discharges. If there is chronic irritation present and if there are mastoid cavity. So these are the etiologies of the carcinoma. Pathology. Pathology is the study of abnormality and what are the abnormalities in the carcinomas. It arises primarily from the middle ear. It's a primary tumor, so it arises from the middle ear or the mastoid. In this case, carcinomas mainly arise from the middle ear. Extension of carcinoma of the deep meatus. Squamous cell is most common. So squamous carcinoma is most common type of the carcinoma of the middle ear and mastoid arise from the middle ear and its extension of carcinoma of the deep meatus. Adenocarcinoma is also present. So squamous cell is very common, most common, and then other can be, it can be adenocarcinoma. Adeno is the carcinoma from the glandular tissue. Adena is the term adeno for the glands. This is the otoscopic appearance of the ear. Then the spread of the tumor. This is the tumor present. Then this is the parotid gland. Spread of the tumor. Carcinoma destroys ossicles. It is present in the middle ear. So ossicles are the bones of the middle ear. So it can destroy the ossicles, which are the middle ear bones. It can destroy and affect the facial canal, internal ear, jugular bulb, carotid canal or deep bony meatus and mastoid. So all these are the structures that can be affected by the spread of the tumor, and depending on the areas which are affected by the spread, we can have the different symptoms and signs depending on the area involved. May spread in petrous pyramid towards its apex. So these are the areas that are affected by the spread of the tumor. The clinical features of the carcinoma, there is chronic foul-smelling discharge, especially when blood strained. So we mentioned previously, I mentioned that 75% of the cases have the discharge from the ear. This discharge is foul smelling, if you see foul smelling discharge, especially when it has blood with the discharge. So this is the patient present with foul smelling discharge. Pain which is usually severe and comes at night. So pain is present which is more severe at night time. There is facial paralysis. Again, the facial, it can affect the facial canal from which the facial nerve is present, and that involvement of the facial nerve can lead to facial paralysis. Especially Bell's palsy is very common, in which the face or mouth is deviated to one side. So one side is affected, the mouth is deviated or towards the side which is normal or healthy, because one side is affected and weak, so that the side that is healthy pull the muscles, pull the mouth towards that side. So this is the diagram. The wrinkling is, there are loss of wrinkles also on the forehead. There is drooping, mouth turns to one side or droops down to one side. There is loss of nasolabial fold also. So these are all the features of the facial palsy or Bell's palsy. Friable hemorrhagic granulation or polyp is visible on examination. Appearance or increase in hearing loss or vertigo. Hearing loss is present, which is usually conductive type of hearing loss because of obstruction or blockage to the transfer or transmission of sound waves from the external ear to the inner ear because of the presence of the tumor or cancer. Diagnosis of the cancer is biopsy is the definitive diagnosis for all different carcinomas. Clinical and radiological examination can also help to visualize the radiological examination to visualize the tumor or the carcinoma, and clinical features can also assist in the diagnosis. CT scan and angiography is performed. Treatment is surgery, a radical mastoidectomy, subtotal or total petrosectomy. So mastoidectomy radical can be performed along with total or subtotal petrosectomy. This is the diagram that shows the mastoidectomy. So the whole radical mastoidectomy is performed. Radiotherapy is a palliative measure when tumor involve cranial nerves 9 to 12 spread into the cranial cavity or the nasopharynx. So surgery and radiotherapy are the main treatment options. Radiotherapy is a palliative supportive measure and usually is performed when it affects the cranial nerve 9 to 12 and when it spreads to cranial cavity or the nasopharynx. So that was all about section 4. Thank you for watching sqadia.com.